Today, I will be doing my PowerPoint case presentation on irritable bowel syndrome, or IBS. A 30-year-old female patient presents with cramping and bloating associated with recurring and episodic abdominal pain, nausea, and constipation for the past 3 weeks. The patient is able to sleep despite the abdominal pain she has been feeling and continues to maintain a healthy diet, but she feels that her consumption of food worsens her pain until she defecates, and where blood is not present in her stool. Additionally, the patient has been experiencing feelings of anxiety and depression, which she feels is reducing her outlook on life. Amidst her symptoms, she has not lost weight in the course of the 3 weeks. The causes of IBS or etiology is unknown. However, some factors that are associated with IBS are gastroenteritis, an infection caused by bacteria or virus that results in intestinal lining inflammation, alteration in gut microbes. All humans obtain a healthy gut flora. However, those with IBS may have gut flora that differs from those with a healthy gut flora. Abnormal serotonin metabolism. Serotonin is responsible for mood regulation and is a signaling hormone for the GI tract. Abnormalities in serotonin results in feelings of depression, aggression, and impulsiveness. Continuing on the etiology, the SCN5A gene instructs the body in making sodium channels. The gene can be pictured right over here. The gene can be found in heart and muscle cells regulating electrical conductance and activity. Mutations in this gene can result in heart conduction defects such as arrhythmia. Low-grade mucosal inflammation is described as mucosal inflammation with a burning or tingling sensation as a result of immune cell abnormalities such as mast cells, B and T cells, and induces mucosal cytokine production. Back in the day, IBS was known as an irritable colon by Jordan and Kiefer in 1929 to emphasize the musculoneural disturbances that occur in the colon. Both irritable colon and IBS present similar symptoms such as abdominal pain and abnormalities in bowel movements. In the U.S., there are 2.4 to 3.5 million physician visits, and where 35 to 40% of those with IBS are male, and 60 to 65% of those with IBS being female. On estimate, IBS affects 10 to 15% of the population worldwide. The risk factors of those developing IBS are those under the age of 50, gender, which is more common in females, those with a family history of IBS, and those with mental health issues such as anxiety and depression. The pathophysiology of IBS is unknown. However, some factors that can contribute to IBS are gut motility, which is an abnormal or an increase in lumen contractions. An increase in contractions can lead to constipation, which contain weaker intestinal contractions, producing hard or dry stools, and diarrhea, which contains stronger intestinal contractions, producing a more watery stool with bloating and gas. Visceral hypersensitivity or hyperalgesia is also known as a risk factor in IBS. It is when there is an increase in sensation of afferent nerves in the GI tract in response to stimuli of the receptors in the gut wall that transmit the signals to the brain. In this diagram, you can see the normal state and the state in where the body is experiencing visceral hypersensitivity. The DRG neuron functions to relay sensory input from peripheral organs such as the intestines to the brain. DRG being overly sensitized causes the gut to be under mechanical stress, activating pain mediators to stimulate the sensation of abdominal pain. The symptoms of IBS include abdominal pain, presented as gas, bloating, and cramping, a change in appearance of stool, which can be hard or watery, and change in frequency of bowel movement, which is having diarrhea and or constipation. Serious symptoms of IBS include nausea and vomiting, persistent abdominal pain, and weight loss. IBS is a diagnosis of exclusion, in where the diagnosis is made after serious diseases are eliminated. Diagnoses of IBS include endoscopic evaluations, in where a thin and flexible tube, also known as an endoscope, is inserted into the abdomen while the patient is under sedation. It functions to evaluate symptoms of abdominal pain. CT scans are a diagnostic image test that helps evaluate the causes of abdominal pain and detect diseases in internal organs. An abdominal ultrasound functions to show images of blood flow in the structures of the abdomen, which is shown over here, through the application of a gel on the abdomen and through the use of an ultrasound device. Blood tests are also used to detect lactose intolerance or celiac disease. Celiac disease is an immune disease against gluten. Gluten consumption damages the structure of small intestines. A diagnosis can also be made using the Rome criteria. Rome 3, shown over here, is an older criteria for IBS, and Rome 4, shown on the right, is the newly updated criteria for IBS. Those diagnosed with IBS have to at least have recurrent abdominal pain 1 day a week in the last 3 months, and to have symptoms regarding defecation that is associated with the change in frequency of stool and the change in the appearance of stool. There are no known treatments or cures for IBS. However, symptoms of IBS can be alleviated through laxatives, a high-fiber diet in which the foods are represented in the image here, antidiarrheals, antispasmodics, which suppress muscle spasms, prosecretory drugs, which is used to treat chronic constipation, and antidepressants. Despite treatments, therapies for IBS can be used, such as probiotics or prebiotics, which helps promote healthy gut flora, and that can be found in kombucha, hypnosis, yoga, cognitive behavioral therapy, and dietary interventions. Listed here are my references for this PowerPoint. And this is a second page for my references as well.